Mike Wilson here, the host of Stutter with Confidence podcast, and I'm very happy today to be joined by Dr. Courtney Byrd. Courtney, if you would, for those that don't know you, just tell people where you live and what you do.
Thank you, Mike. It's an honor to be here. I am a professor at the University of Texas at Austin, and I am the founding and executive director of the Arthur M. Blank Center for Stuttering Education and Research. And I've, spent the last 2 decades of my life having the privilege of working every day with children, teens, and adults who stutter and their loved ones.
And I saw a quote from you on that note saying that you've learned far more about stuttering from people who stutter than from any other source. Would you like to expand on that?
Yes, I mean, I am indebted for the rest of my life to the stories and insights and time that the stuttering community has invested in sharing with me their knowledge and their experience, and everything that I have learned has shaped and continues to shape everything that we do.
Nice. And so just kind of diving right into it, what are some things that you didn't learn that you didn't learn, say, in your formal education as an SLP, that you've learned from folks who stutter? Like, what insights have you come to, and what perspective of stuttering perhaps wasn't complete, or maybe was totally lacking in the formal education that you've learned from experience and from getting to know folks who stutter?
Well, I mean, let me just please say that it's pretty much everything. So, but I'll give you as much of a holistic perspective as I can, also with some critical details. To begin, when we look across the accredited undergraduate programs, nearly 100% graduate students without having had any exposure to stuttering. In fact, we published a paper on this, and if you think about the scope of practice for speech language pathology, these students get exposure to articulation, they get exposure to language, voice, but nothing as it relates to stuttering, which is really core to our field. Then you move up into the graduate programs, and a lot of what happens is kind of finagling. How can you get exposure to stuttering and just check the box? And so it's done in different ways. Maybe you can attend a support group meeting. Okay, there, now you know about stuttering. Maybe you can have an opportunity to observe some videos of therapy. Then you've checked the box. Maybe if you're lucky, it gets added into another course. Relatively few institutions have people who are at their university who have specialized knowledge in stuttering, who are actively involved in the clinic aspect of how we should best serve people who stutter, and also actively completing research and teaching. And so I think there are data to suggest that actually less than 1% of practicing clinicians feel competent to serve people who stutter, but importantly, more than 95% report having someone who stutters on their caseload. And so what have I learned? I've learned from the first person I ever worked with, a 13-year-old boy, that whatever doesn't work as it relates to fluency, the language that's projected back to the person who stutters is that it's their fault, their responsibility. So let me give you some insight. Kevin was 13. I remember him recording himself. This is when tapes were something that we actually used, and he would rewind it, play it back, and he would come and he would cry, and he would tell me, I'm practicing and I'm doing everything you're asking me to do, but as soon as I walk outside of this room, I can't talk the same way. And I went to my supervisor at the time. I mean, I think I was 19 or 20 years old. I told her, like, look, I believe him. He's telling the truth and he's recording himself. And she said, well, this is what they all say. He's a teenager, he just needs to practice more. And ultimately what she told me to do was to discharge him and tell him he wasn't ready for therapy. And when he was ready and motivated to come back, well, that exchange haunted me. I mean, it still haunts me today because that was his life. And what was communicated to him was it was his fault. So I was determined to figure out what is the best path. And it's been an uphill battle. And what I've learned is that, when you don't talk about stuttering with young children because you're afraid that it's going to make them be aware and therefore be concerned, what you're actually doing is you're waiting for concern. You're waiting for the point that's for some point of no return. You're waiting for it to become an issue when you could actually educate, teach them to advocate, and also teach them to communicate. So much of what we do, we say to protect and to help. So Johnny, you don't have to present in class. Nobody's going to ask you a question. You don't have to ask questions or raise your hand. And if you ever have to give a presentation, we'll let you record it. Well, that's not real life. So what happens to him 10, 15 years later? Pragmatically, he's underdeveloped. Socially, he doesn't have the self-esteem to navigate situations because he hasn't had the opportunity, all veiled within this notion of trying to help, when really what we're doing is causing harm. And I think that, when you ask parents too, have you ever talked to them about stuttering? 9 times out of 10, they'll tell me they don't because another speech pathologist told them not to. But guess what the medical literature said? We just published a paper about this recently, is that when a child has a life-threatening illness, and it's a word they can't even pronounce, the best thing that you can do is to tell them the word. This is what it is. And let me tell you what this means. And what happens as a result is the parent is more likely to talk to the child about it. The child's more likely to ask questions. Both the parent and the child are less likely to have anxiety and to feel safe and secure and just having the knowledge versus not knowing what's happening. So I could keep going, Mike. I feel like I gave too long of an answer, but I could do that for an hour. There's so many different things that I've learned. And it's typically, if only I would have had, if only someone would have told me, if only I could have. And that's what drives me every day to try to reach people who stutter before, anybody has a chance to teach them that it's not okay, either implicitly or explicitly.
That's so important. For me, and I was brought to speech therapy, as soon as my parents, I think, noticed a stutter. They, like any other good parents that are doing their best, you see your kid has a thing going on, and you look for expert help. But I never remember being aware of my stutter at all. Now, from what they say, I had the stutter again from the time I started talking, and sometimes I appeared a little, frustrated that words weren't coming out as fast as I wanted them to. But I never remember having an ounce of shame or embarrassment or anything like that until I got to 6th grade. And just from this podcast, people have interviewed and other folks I know that stutter, for so many of us, it seems to be at like age 9, 10, 11, sort of around that. I don't know what the research shows, but at least anecdotally, a lot of people have told me that. And I had that experience in the 6th grade, the first time I was made fun of about it. And I had just gotten, to that age where I started, liking girls. And I liked a girl, and another boy liked the same girl. And, he, I guess, noticed my stutter, and so started using it against me, making fun of me in front of other kids. And suddenly it was like, really? There's something weird about the way I talk? I had no idea. And now you're in a sensitive age, right? That, middle school age, when you're just sort of waking up to, I don't know, caring what other people think and that sort of thing. And, really, cliques are starting to form in middle school, whereas they weren't there in elementary school, that sort of thing. And suddenly you realize this, thing about yourself, oftentimes because somebody else has made fun of you about it. And that iceberg just formed fast, deep and dark. And suddenly my mission was to not give anybody ammunition to make fun of about my stutter, which meant, not say it if you think you're going to stutter. First of all, think about stuttering a lot, right? Like be aware of, oh, there's this risk looming at all times that I'm going to, just get bombarded with horrible feelings inside because I stutter and somebody makes fun of me. And so you start avoiding like the plague. And very quickly, I mean, the iceberg was formed deep and dark and powerful, and it stayed there through the end of high school. I mean, my senior year of high school, it was, so extreme, if you will, that the only two kids in class in my school that I was comfortable to talking to, and I mean, I still hated my stutter, but that I was okay with stuttering in front of, neither of them happened to be in my lunch period. So rather than just find another table with nobody at it, and they would sort of cover for me too in social situations when someone would ask my name and they look at me and know, that I was, sort of like the deer in headlights. They would say, oh, Mike's, isn't it? That they would cover for me, and they weren't there to cover for me. And so rather than find another table, I literally brought my lunch into the bathroom stall my entire senior year, the entire lunch hour, and living in dread that somebody was going to, discover I was hiding in the bathroom. Luckily, neither of those two friends ever asked which lunch period I was in. They just never thought to ask, I guess. So nobody ever knew that until a few years ago. But just living in dread, somebody would discover me smelling other boys' stuff as they came in to use the bathroom in the next stall as I'm eating my lunch, just like, is degrading, an experience as, as I felt like I could possibly have. And meanwhile, I was going to speech therapy through most of those years, but it was always just like you said, hey, let me teach you this technique, whether it was, a breathing thing or easy onset. Seems like, everybody loves their easy onset in the speech therapy world when it comes to stuttering, or a lot of people do. But it was always like, okay, now, you've been saying your D word, you've been practicing your D words, dog and dinosaur and donut, and you're saying them just fine here. Now, just go out and do that. Just go out and use it. It should work for you. So like you said, then you walk out of the room and it falls apart. I mean, maybe it lasts for 60 seconds and then it's just gone. And you're sitting there like, why? But you blame yourself. You're like, well, the adult, expert speech therapist is telling me this should work. And so you assume that it probably works for other people that stutter because they're telling you it should work for you. So you walk out and it failed, and you feel like you're failing over every single time you go out, and that everybody, your speech therapist, everybody in your life, you think, wants you not to stutter or to stutter less. Now, as it turns out, most people don't really care. They're more interested in what you have to say than whether you stutter some when you're saying it. But it really gets in your head that that's what the world cares about. And that as long as I'm stuttering, I'm failing and I am basically laughable, and nothing I say matters so long as I'm stuttering, which is, for a human, I mean, we're such a social, our identity, our life is based on our relationships with other people, and so to feel like you're completely cut off from that is, I don't want to compare it with other conditions and which one is worse, but it's miserable. I mean, I can't tell you how many times I, during those years, would have, if you would have said you could be like we could amputate, you had a choice, amputate all 4 of your limbs, but you wouldn't stutter, or, keep your limbs and stutter, I probably would have chosen the quadriplegic route. Just because I knew I had a lot to say, I knew I loved talking to people. I knew I loved communication, and I felt completely cut off. And sometimes when you feel cut off from something, it makes you love it and want it even more, right? So I feel like a lot of folks who stutter perhaps love to communicate even more than the average non-stutterer, because we feel like it was, we were deprived of it, for so long. Anyway, I covered a lot of ground there, but do you have any idea why? Because when I look at the history of stuttering, people like Van Riper and Sheehan, they did understand it was Sheehan that coined the iceberg term, but they certainly understood the shame of it. They were people that stuttered themselves. And it seems like by the time I came along for speech therapy in the 80s and 90s, I never had anybody close to a Sheehan or a Van Riper, somebody who really understood the importance of non-avoidance and understood that we're probably not going to cure you here. We're probably not going to teach you a technique that's going to enable you to have 100% control in the real world. Was it, from what I read in Oliver Bloodstein's book, there was kind of a revolution, I guess, so to speak, in the 70s, like a fluency craze, and everybody, the speech therapy community sort of got addicted to this idea that, we can just teach people to stutter a technique, and for whatever reason, they didn't bother to measure it in the real world, in the real situations. It was, I don't know. What are your thoughts on that?
Well, at first, I just have to thank you for sharing what you did. I keep thinking about you in high school and being in that bathroom, and I was wondering if your parents knew that. They never knew. So hard, Mike.
A real quick story on that. So a few years ago, when I started, really talking about my stuttering journey for the first time, I was on a FaceTime call with my dad at the beginning of the conversation. And then there was some, technical glitch where maybe 20 minutes into the conversation, he wasn't able to see me anymore. So I think he forgot we were on. I could still see him. For the rest of the conversation, he couldn't see me. So I think he forgot probably that we were even on a FaceTime call because he couldn't see me. And when I told him that, and, my dad's not a crier, other than when, loved ones dies, other than that exception, he's not a crier. And when I told him that story, which happened 20 plus years before when I was in high school, I could see him getting emotional about it. And so, no, they didn't know, nobody knew. And then once and we haven't gotten to that yet, but once I did find my confidence in college, which came from, as I call it, eye contact training, where I was brought around campus at Florida State by Dr. Richard Ham. I don't know if you've heard of him. He ran the program at Florida State. But he introduced no speech techniques the whole first semester at Florida State, brought me around campus, just made me ask people questions and learn to look them in the eye when I stuttered. So rather than, no, Michael, look him in the eye. Michael, look him in the eye, right? And after 4, 5, 6 sessions, I could finally just bring my eyes back and look at the person. And that for me did a ton to making me realize that stuttering is okay, actually.
Yeah.
But anyway, so I found that, I did 1 semester of that with Dr. Ham, I would say I melted 90% of my iceberg at that point, because I made the decision, I'm going to say what I want to say. I'm not running away from words anymore, because that's a miserable way to live, as illustrated by my high school experiences. And so I sort of just didn't even think about stuttering. I would literally forget that I stuttered in between conversations. And then I'd have the conversation. Oh yeah, I have a stutter. That's right. But, but I truly trained myself not to give a, what, and not to, not to dwell on it. But I wasn't at all involved, for example, in the stuttering world. I didn't know until a few years ago how many people that stutter are still in some similar state of mind to where I was in high school. There's still a lot of shame, and I know people in their 70s that still, right, that their whole life has come and almost gone, not yet, they're still alive, but in that intense fear and shame. But as you know, and I know that's one of your big missions in life, it doesn't have to be like that, right? Whether we, quote, improve the actual physical stuttering or not, it doesn't have to be. So being a person who stutters doesn't have to be akin to living in, a social prison your entire life.
It doesn't. And I think that, in many ways, speech pathologists hold the key. And so you said, when I think about your dad, his emotional reaction to that, it's, what goes through my mind is, it didn't have to be that way for him either. He's thinking of his son in the bathroom and thinking, he wished he could take that away from you. He wished there's something he could have done. It's painful to think about your child going through that. And, you mentioned Van Riper and Sheehan, both of whom obviously were geniuses. Yet what I want you to understand is that their focus was on the adult. And at that point, it's already been formed. And, when I have over the last, 20 years have presented on, this is, you also mentioned, 7, 8, 9, I think is what you said, is when you've seen a lot of people saying that's when they remember, kind of starting to feel feelings of embarrassment. But, the data actually show that children as young as 2.5 years of age can feel shame, can feel a negative attitude towards their communication. So what are we doing to help to prevent that? And when I talk about the fact that we teach children at a very young age what stuttering is, we tell them, stuttering, this is what it is, and here's what it looks like, here's how it can differ. And you're going to meet people who will not know what stuttering is. In fact, some of the smartest people that you encounter, like your teachers, your parents, the people that you hold in the highest regard, will have never met anybody else who stutters. So that makes you special. You have the opportunity to teach them. And in teaching them, you're not only going to be able to help them to better understand what stuttering is, but you're going to be able to help the other kids out there and adults who stutter who might encounter those people, because then you've made a difference. And so the story that I give, and I don't want it to be overused, but it's just one of the best ones, and it's an authentic story. It's that we had a young girl who was 4 at the time, went to the dentist, and the dentist was asking her name, and she responded back and stuttered, and then he basically mocked her. And at that point, if she had not been with us, what would be the standard response would be for her to look at her mom and not know what to say. And then the mom would, as would be typically advised by the SLP, would be not to say anything in front of her daughter, tell the dentist, we'll talk about it later. She's in therapy for it. We're getting work for it. But this child looked at her mom, looked at the dentist and said, oh, you're one of those people who hasn't ever met anybody who stutters before. Stuttering is something that is different in my brain. And so when I'm speaking, I know exactly what I want to say, but sometimes it comes out a little bit differently. My uncle also stutters. And if you have any questions about stuttering, feel free to ask me. And so what you have to understand too is when they drove home, unlike your father, it's like that mom doesn't feel guilty. That mom feels a sense of relief, a sense of pride, understanding that her daughter can handle it, even though she's only 4, you know, and that she doesn't have to rescue her from ignorance because she's going to encounter that. And so she has to be equipped to navigate it. And then the daughter also feels empowered. She doesn't have to feel like, you know, it's like, wow, I just taught someone. I can feel proud of that. I can actually go home and tell someone what I just experienced. And that singular event can change the entire course of a child's life. And that's what we know. And we know that from psychology, but people will say to me to this day, you know, I understand teenagers and adults, but I get really uncomfortable with you talking with kids about it. And the point that they often make is, you know, kids can outgrow it. What if they outgrow it? I say, well, what if they did? What difference does it make? Why is it a negative to teach children how to advocate? Why is it a negative to teach children about ignorance and how ignorant people behave ignorantly and how they can change the world by helping people to understand what differences are and that it's okay to be different? I mean, I have so many adults who say, if only I could have known the uniqueness of my voice. If only I would have understood that it was okay to stutter. If only I could have been taught that communication isn't defined by fluency, because it's not just advocacy, Mike. It's not just education and being able to speak about it. It's also learning how to communicate confidently. I mean, the kids who stutter that come through our program, they're more effective communicators than kids who don't stutter. I want them to be far ahead of the game. So when they're coming in the room, people aren't clapping because they stutter and, oh, wow, we're proud of him for getting up and speaking. They're amazed by the level of skill. And then what happens, you said earlier that you couldn't remember if you stuttered in between exchanges. Our data actually show that when people are listening to people who stutter, children, teens, adults, and they've got strong communication competencies, and you ask them, were they stuttering? They say things like, I don't know, or maybe, or if they give a frequency, it's significantly lower than what it was. To the contrary, when they have low communication competencies, when they're communicating like this, when they're looking away during the stuttering moment, even when the frequency is low, they report it as being significantly higher than it is. And so it's so important to understand that you can change your communication, and it's not dependent on severity, but in changing your communication, it can change the way people interpret the severity. And so I get very frustrated because right now it seems like it's becoming more in vogue to say that, you know, it's okay to stutter, and yet people say it's okay to stutter, and yet their treatment goals are to increase fluency. Their treatment goals are to reduce stuttering. It's like, well, you know, you can't have that contradiction and think that the person, whether they're a child, teen, or adult, are going to believe you that it's okay. If it's really okay, then why are you measuring it? If it's okay, then what else can you look at? You can look at communication. And you also said yourself, you were in therapy for years. Where else is that okay? You're in therapy for years. So I have people ask me, well, I just don't feel comfortable discharging them when they're still stuttering. And I say, well, why can't you feel comfortable discharging them when you know they can communicate effectively, when you know they can advocate meaningfully, when you know that they aren't avoiding any situation, word, sound, person because they stutter? At that point, you should feel comfortable discharging them. And let me tell you, here's the difference. If you're waiting for fluency and you're waiting for them to get to a place where they're at, well, no, so whatever your arbitrary guideline is for frequency, which is completely arbitrary as it is, well, then you could have them in therapy for 7 years. And so, if that's your singular focus, imagine that person at the grocery store. Think about them 15 years later down the road. How are you going to feel as their clinician when you see them in line and they're checking out and you can sense and feel their discomfort, their shame, their effort to hide their stuttering, trying to use those easy onset skills in that moment and it's not working for them? Are you going to feel comfortable going up to them and saying, hi, how are you? I hope you're doing okay, versus the person who says, hi, yeah, I'm a person who stutters. You might hear me repeat a few sounds or words. Anything I say you don't understand, let me know. I'm so excited about this. And then, oh, hey, Jason, good to see you. You know, it's a totally different exchange there. There's no shame, there's confidence, there's communication, there's advocacy. And then you can walk away knowing you helped that person to live their life. You didn't teach them that the only way they could actually live a life would be to speak fluently. I mean, there's so much vulnerability in that. And it's easier really to focus on the fluency. It's easier for the clinician, but it's much harder to focus on all of the other. But in focusing on all of the other, you're giving them an opportunity to be who they were born to be.
Yeah, I love that. And what's the other day I had a podcast chat with Chris Constantino, and he pointed out, and this makes total sense to me, and it was the case in my case also, when you give them that, confidence, that courage to go out and be themselves, and to never avoid words, sounds, situations, that's sticky. So that's something that the therapist or the coach, and I'm the person that's working with folks who stutter, whatever capacity that may be. And I don't think that, given the track record of a high percentage of a generalist, SLPs with folks who stutter, well, you said it, probably less than 1% are doing the things that really should be done with folks who stutter. And a lot of them, in my opinion, and I think you hinted at this, a lot of speech therapists are actually doing more harm than they are good, which is, I hate to mention it, but violating the Hippocratic Oath, right? That's one of the top things, because the bottom line, obviously, is the speech therapy world, nobody's cracked the code, right? We can't just, teach somebody a technique that'll, okay, nothing more to see here with their stutter ever again, so nothing to be ashamed of. It's not how it works. If the code was cracked, well, maybe that'd be the best thing to do, but it's not. So that doesn't exist. But when somebody learns that they don't have to run away from stuttering, that they can be themselves, that they can live their life, that is a revelation to them and a revolution in their life. And that, who wants to go away from that once you have it, right? So that is sticky. Is that what the research shows, that when you effectively melt that below the iceberg stuff, that lasts, that melting of the below the iceberg lasts. Whereas the stuff that's done above the iceberg, especially in the absence of dealing with the stuff below the iceberg, whatever improvement you think you see with the above the iceberg is just not going to stick, so long as and I like the sports analogy, so long as the athlete is terrified of making a mistake, they're never going to reach their full physical potential. The athlete has to play fearless. They have to not be playing scared, or it's going to completely impact their ability to make that shot or throw that touchdown pass. I know you're at UT Austin, so you guys are good at both of those sports, but and so it's really doing more harm than good if you just focus on the above the iceberg, maybe pay a little lip service to below. No, the below is the foundation of the whole thing, right? And if somebody, this is obviously ironic, and stuttering's very paradoxical in some ways, but if you can melt, and this was my experience, as I said, with eye contact, I was able to melt probably 90% of the below the iceberg. By the time I got to dental school, I would say it was up to 99, 0.7% of it was melted. I knew at that point that I, shouldn't walk around feeling inferior to anybody in the world. As Joe Biden's mom told him, which I agree with, don't you let anybody tell you that you're worse than them just because you stutter. However, you're also not better than anybody.
Right.
I agree with that. That's the sweet spot, right?
Yep.
But if that below the surface of the water portion of the iceberg is removed, well, the stuttering that remains is, by definition, if indeed this is the structure of stuttering, like a real iceberg in the ocean. You remove what's below the surface, what's above the surface is going to get a little weaker, a little more wobbly, a little more susceptible to, possibly working on your speech so that you don't struggle as much when you stutter. However, if the goal of the technique is to never stutter, to hide your stutter, then it's just, you're always walking on super thin ice, I think.
Yes. Okay. So a few things. Cracking the code, and I want to respond to a few things you said. I think if cracking the code means that you can have someone who stutters be fluent, then it's. I would say to you, empirically, we've got, I mean, hundreds of years of data to suggest that that's not possible. People don't like to hear that because there are programs for preschoolers that would suggest that if you're in it, you can see change. But I would argue we don't even know the natural recovery rates. So what are we actually capturing in this? Are we capturing, children that are actually responding to therapy? We have markedly different programs that show the same outcomes. Why is that? I mean, from a scientific perspective, that should give everyone pause. Is there a common factor? Or is it the common factor is that we're capturing variability and natural change? We don't know. But, the iceberg, what I would say to you is we spend so much time waiting for the iceberg to form. And my point is, it doesn't have to. It does not have to form. We have children who stutter that we work with, and they go on to do remarkable things. And they look at stuttering entirely different than the adults and the teenagers and the school agers that I work with who spent most of their life at that point trying not to stutter. And so they see these kids and it makes them cry because they see something that they realize they never had. So I have these groups where I have 70-plus-year-old men and women meeting with our 3, 4, 5-year-olds and seeing them get up in front of 300 people and talk about their stuttering and use their eye contact, their gestures, their intonation, and they're stuttering all over the place. And they're saying things like, it's okay to stutter, stuttering's not going to stop me from doing anything I want to be. And they're just openly weeping because it's like, I never, if I would have known that, it would have changed everything. Now, interestingly, and you said yourself, stuttering is a paradox. For some people, and this is really important, if they come to us as, even for school agers too, if you've gotten into a place where you are sophisticated at avoiding, when you actually, melt that iceberg, as you said, you actually see more stuttering. So it's not this case that your frequency will always go down. Sometimes it goes up, and that's a victory because that means you're talking more. So speaking fluently to me means saying what you want to say when you want to say it. And that is what is critical. I just think fluency in and of itself is an act of conformity. I mean, people who don't stutter are disfluent. We all talk in different ways. But we as a society have this expectation for people who stutter to conform. And who is the largest contributor to that? I strongly believe as a speech language pathologist. And like I'd say, people will say, I work with adults, I desensitize them, I focus on all of these different things. But then you ask them, well, what are you doing with children? Well, I just don't feel comfortable doing voluntary stuttering with children. I don't feel comfortable talking with children about it, unless, of course, they show that they're aware. And it's like, well, why is it not okay to talk about stuttering? If you're concerned you're going to increase their concern by telling them what it is, maybe you need to think about your own reflection on what stuttering is. Because when we talk about stuttering with these young kids, it doesn't in any way feel negative. It's informative, it's neutral, it's positive, it's exploratory, and it's eye-opening, and it's demystifying. And it's all of the things that they need so that they can not hide in the bathroom, so that they never find themselves being worried about, nobody is going to be able to take their stuttering and use it against them because they're armed, they're forearmed, and they're prepared. And because that's just real life. I mean, we all, understand that we're not better than anyone, but people will try to make us feel less than, and they'll try to find our weaknesses. And guess what the bullying and teasing literature show? They can't identify if people who are targeted are those who are more socially reticent, or if you become more socially reticent because you've been targeted. So when you interpret that empirically, what that means is we have to proactively get kids who stutter to be the first person to walk in the room, say their name, shake hands, and basically drop the mic. But, you know, if we're not helping them and teaching them how to be better communicators, and not like putting them into circumstances where we're helping them, but really we're compromising their ability to grow in the development of their communication skills, it's, you know, I just feel very frustrated with that part. And you would be surprised. I have had people walk out of my presentations and say, well, I saw your pre and post and they're still stuttering. And I just, you know, I don't understand. And it's hard. And then they'll ask me about, you know, other people in the field who say, well, this is good for teens and adults, but with kids, we really need to focus on this. I say, well, how many kids do they actually work with every day? And how many adults do they work with every day? How much clinical services do they provide? And let me tell you, even if you're board recognized, a lot of people who are very much focus on fluency. So I feel like there's going to need to be a real grassroots effort. People have to be responsible. They need to stand up and say, hey, yeah, 5 years ago, I was saying this is what you should do with kids. And, you know, I'm sorry. I understand now that we shouldn't. And this is the way, this is the new path. Let's all get on board. We are actively changing school district guidelines so that, you know, frequency shouldn't even be the measure of outcome. I mean, it's implicitly telling kids, you know, it's not okay to stutter when you're telling them they can't be discharged until they're stuttering less than a certain frequency. And who comes up with that guideline? I could keep going, Mike, but so.
Well, I think it probably comes from other areas of medicine, right? I mean,
Right.
if you know, you have a limp, let's say, because your leg is hurting, you go to the doctor, you know, you're hoping he'll fix your limp so that you won't limp anymore and you won't hurt anymore, right? So I think it's trying to take this typical, you know, and it's the same in dentistry. Hey, you know, hey, doc, my tooth hurts here. What they're telling me is, can you fix my tooth, right? That's what they want.
Yes.
And so I think the problem is applying this medical mentality, which is the same in, say, with, you know, psychologists, you know, like, you know, someone goes to a shrink, they're like, doc, I can't stop, you know, thinking about whatever, but, you know, the fact that I'm losing my hair, or the fact that that my wife's not as not, you know, whatever the case may be. I'm anxious about this. There's this implication that I want to be fixed, right? And so, you know, that's probably where it comes from. And a lot of parents are, when they bring their kid in, that's what they're probably expecting, right? Hey, my kid's stuttering. Can you make it so that my kid doesn't stutter anymore, right? So there's a lot of pressure, which probably came naturally, but that's all counterproductive. We now know, right? That's all counterproductive. And it's awesome that you're mentioning this, because probably the best thing I've ever heard in my life from someone that stutters, that a parent of theirs did for them. It's a girl or a lady now who's from one of the Scandinavian countries. I forget which one. She's now a journalist in the UK. She said her mom recognized before she went to school, and, you know, she's my age. This was in the, you know, like early 80s. You know, her mom recognized it. She definitely had a stutter. So she told her daughter, okay, when it was the first day of school, I think they started at 6 years old then. She told her daughter, I want you to go in there. First thing, stand up in front of the whole class, look at everybody and tell them that you have a stutter, but that it's not a big deal and they just need to be patient.
Yes.
And so that's what she did. And lo and behold, she never didn't pursue a dream in her life. Like, she largely doesn't have the iceberg. You know, she still is a little bit annoyed by the fact that, you know, her words don't come out as fast as she wants, but, you know, which is to be expected sometime. But she didn't have that stuttering is ruining my life sense ever. But she started at that young age. And I've really, until this conversation, Courtney, I have stayed away from an opinion when it comes to kids before the iceberg is formed, because, I've known a lot of adults that stutter, now, like hundreds and hundreds. I don't remember my pre-iceberg stage from a stuttering standpoint. The first time I remember it was when I remember now, at least, becoming aware of it when I was in the 6th grade. So that's been a black box for me, what you're supposed to do, with a 4-year-old. And my 4 kids, none of them, have shown any signs of stuttering so far, which has been an indication for me. And I know it's anecdotal, but you see your 4 kids up close, like none of them are anywhere close to stuttering. They have a thought from the moment they knew how to say that word, they say the word and they say the next word and they just go forward. Whereas from what my parents tell me, it was, when I first started to talking, I was always stuttering. Now it was more of a falling forward sort of a stuttering, not a like hit a wall, Michael can't say this word, sort of save his life in the moment, sort of stuttering, like what later came once my iceberg formed. In my case, when I started having those, big blocks for a while. But anyway, this has been very enlightening for me, and what you're saying makes total sense. And this experience that that the lady from Scandinavia, I think she's from Sweden, had as well with her mom, that she didn't get that. She was one of the only adults I've ever met who stutter, who didn't have a massive iceberg that was built up, or who didn't at least have one in childhood that they've gradually, had to work themselves out of as they get older. Everybody else that I've met, at least, has a stuttering iceberg that was pretty deep and powerful. And so that's so key to prevent it in the first place. Now, well, and it makes sense. And I'm thinking here how almost paradoxical Wendell Johnson was in this sense, right? Because I think a lot of this comes from Wendell Johnson's thought, was it a diaxogenic, where when you tell the child that stutters that he stutters, the 5-year-old, this I think is how Johnson thought about it. If you got a 5-year-old that's stuttering, let's say, don't tell him he or she stutters, because then they're going to start trying not to stutter. They're going to become aware of it. They're going to start trying not to stutter. And his famous quote was, stuttering is what you do when you're trying not to stutter. So that I think had a huge impact on how speech therapists thought about it, probably up until now. You're not supposed to tell them. But at the same time, what you're saying, and I think it makes much more sense, if you can prevent the iceberg from forming in the because I, coach some folks that stutter now. I don't charge anything for it, but I work with adults who stutter, and we do it as a group, and the key part of it is the eye contact training that was done for me when I was in college, which it's amazing also talking to a lot of other folks that stutter. Nobody else, and I'm sure it was done for others, but I haven't met anybody who had that same thing done for them, where you just go out in the world, talk to people, get used to stuttering when looking them in the eye. So you're facing that thing that you're so afraid of, and people, like you said, people don't even notice the stuttering much unless you're doing some really bizarre things. Like, if you're hitting your leg the whole time when you're talking, they're going to notice that, right? Or if you're, they ask your name and Chris Constantino said for years, when he was hung up on a word, he would look like up and to the right. So, right. And his eyes would stay locked up there for a long time. Well, that sort of thing people notice, because it's, it's disfluencies are not, that out of the ordinary. Everybody has them sometimes, right? But when you're slapping the heck out of your leg, or you're pressing your finger, another person I know would press their finger into their temple to try to get the word out. Those sort of things people are going to notice. But with eye contact, I found it really normalizes the interaction, and people know you're still with them. There's right? I mean, eye contact, no doubt, goes back before human language, right? Like we were looking at each other probably before some caveman said, tree, tree, oh, tree, and language started. I would assume is probably how that happened. Eye contact matters in the animal kingdom, right? And so there's a lot of sort of nonverbal communication that occurs with eye contact. And but I got sidetracked there. So but that preventing the iceberg in the first place, when I work with people coaching them, it's almost entirely about trying to melt their deep and dark iceberg that was formed back in childhood, right? So if that cannot form in the first place, I mean, that could totally revolutionize the way that people that stutter live the rest of their life if you can get to people at that age. Now the question becomes, Courtney, right? And I know you're putting a lot of work into this, doing your level best, but there aren't enough, Courtney Byrds in the world, I would say, and and others that are doing great work like this as well. Folks like Scott Yaris, for example. So how do we reach the masses of kids who stutter? Because I think to this day, the vast majority of kids who stutter that are seeing therapists are seeing them in the schools. And those are generalists in almost all cases, right? The therapists in the schools are generalists who, understandably, that they got to work with every type of child with a challenge with their speech in the school. They're not going to be specialized in stuttering in most cases. Is the SLPs in the schools the way to handle the 6-year-old, the 7-year-old, the 10-year-old that stutters? Or perhaps maybe we've learned during the pandemic, and I'm just brainstorming here, so I throw this out there. What about, because we know you can now do a lot via Zoom like this. You're in Texas, I'm in upstate New York, but we're talking almost like we're in the same room. Would it maybe be better for, say, the 7-year-old that stutters, rather than having them get called out of class, which I've heard so many times, like kids will get called during class, the therapist will knock on the door in class, all the kids are sitting, hey, Michael, you're time to go to speech. Okay, so it's just a shame, just builds from that too. But anyway, rather than going to see the therapist in the schools, and yourself and Peter Reitzis and Bob Queasel, a lot of people I know agree that generalists don't have much experience with stuttering probably shouldn't be working with folks that stutter unless they take the time to know what they need to do and not do. Rather than that, what about maybe having groups where you get, I don't know, 5, 10, 20 7-year-olds who stutter twice a month in a Zoom room with other 7-year-olds that stutter, maybe some mentors, someone like yourself would be great to have in the group as well. But as I said, there probably aren't enough of you, but that sort of situation where you're talking about it. They're being with others that stutter. They're sharing. The one 7-year-old says, yeah, Mrs. Jones called on me in class the other day, and I said what I wanted, and I stuttered, but no one laughed, and it was fine, and the class moved on. The other kids are like, really? You just stuttered in front of your class? Like that sort of peer mentorship thing, with some older folks also, to keep an eye on the 7-year-olds in the room, of course. But what are your thoughts on that?
Well, a few thoughts. First, I want to comment on the school-based speech pathologists, because I think that there are wonderful people who are in the schools who do great work, and they're overwhelmed by caseloads with, many different communication differences that they have to navigate. But I would say it's our responsibility to look at the guidelines that they are set to follow and to change them. And we have done that now successfully across a handful of school districts across the nation. And that's part of my grant, is focused on changing every single school district across the entire country, so that when these children receive support, the support doesn't result in the iceberg growing. It's proactively preventative. The other thing that I want to say is that people, again, who are highly visible as it relates to treatment still support a lot of fluency focus for young kids. And I just think that we need to be more transparent to talk about, the data, to really understand the contradiction of suggesting, modifying the stuttering, reducing the stuttering, increasing the fluency, but it's okay to stutter. And really, we will stop focusing on the reducing the stuttering and increasing the fluency once they get to be a teenager or an adult. It's like at that point, I feel that we have done more harm. And people will, I was at it doesn't matter, but I was presenting somewhere, and the response was that almost what I was doing was a danger to the child. And my I don't know, my battle cry is, again, how many people who stutter do you serve every day? So you say to me, it would be great if you had 5 to 7-year-old groups. I mean, Michael, we see, 1,000 plus kids and adults every year. We've got those groups. We've got people from all over the world. We have our intensive program in 10 different countries. And guess what? The stereotype threat of stuttering is universal. Stuttering is universal. And what we see is focusing on the things that we focus on are transformative no matter the culture, the language you speak. And the earlier, the better. And I've never once encountered a teenager or an adult who said, I wish I would have spent more time focusing on fluency shaping. I just wish no one would have talked to me about my stuttering. I wish everyone would have just ignored it. And, and again, if I could have practiced a little bit more, using that easy onset, my whole life would have changed. It's never that. It's never that. And so I feel that we just need to continue to get more people to put the word out, to get people who maybe took a different path to support what we're doing. Every time I get up to speak, I get scared because there are going to be people that are going to tell me, well, you could be targeting fluency, and why aren't you at least trying? And I say, well, you tell me the data that show that it's going to work. Explain that data to me, and I'll show you my data, and I'll show you the kids we followed for 15 years. And I'm going to tell you what these kids do, because they go on to do remarkable things. They're starting their own companies. They're running for student council. They're the first to talk in their class. They're leading the way in things that require significant communication. And guess what? They're still stuttering, because that doesn't matter. That's not the measure of their success. And it's not that it's just, you need to be okay with your stuttering. You have to learn to communicate. Yes, eye contact is critical. Mutual eye gaze is a basic building block for communication. I mean, that's proven, animal kingdom, humans, that's the first step. But you have also wonderful communication skills beyond that. That is your gestures, your intonation, the way in which you engage the speaker. All of those things are important, and they all play a role. But it has to start with you being able to look at the person first. If you can't really be involved in that exchange. So that's the first step. But there's others too that we've proven empirically make a difference. And then once you actually become very effective at that, and you are also prepared that you might need to advocate for yourself, and you understand how to do that effectively, like the person in Scandinavia whose mom intuitively knew that. We have a paper with kids that show talking about it neutrally, not apologizing for it, is what makes a difference. People will say, tried self-disclosure, just didn't really work. Well, how did you do it? 9 times out of 10, you're saying things like, bear with me, I'm sorry, I'm in therapy for it, something I've struggled with my whole life. None of that is going to gain listener respect, and it's not going to gain self-respect either. If you can just say it neutrally, you keep moving forward, it changes everything for you and the listener. And so I don't feel defeated, but I do want you to know there's still a big mountain to climb. And I need help. I need people to, support it. And ironically, I've never had a person who stutters who has said, I disagree with the idea of getting it proactively. And one other thing that I think I said earlier, but that's so critical, is I think, Ross Menzies said this in a talk he gave, but it's like, and he's a cognitive behavioral psychologist. And he said, one noxious event can change the entire course of a child's life. I feel like we are waiting for that noxious event before we actually act. Why are we doing that? And oftentimes we're waiting until they've had multiple noxious events. And I feel we have an ethical responsibility to prevent those events from happening. And we know that they do. And if fluency shaping was so amazing, where are the panel of people who stutter standing up in droves telling us about the impact it had on their life? It just doesn't exist.
That's super interesting. And yes, I've never met anybody who said, at whatever age, that fluency shaping worked fabulously for them, and even some high profile cases, for example, like Annie Glenn, who went to Hollins, which, got a lot of publicity. I saw, I'm forgetting his name. He died a few years ago, in his 90s anyway. I saw him on an older episode of Stutter Talk, and he was saying, he knew Annie Glenn. Fred something? He lived in Florida, I believe. Anyway, Fred Murray, does that ring a bell?
Yeah, I think that could be, yes.
Yeah. So he was saying, he knew Annie Glenn, and he said it for sure wasn't just a technique that helped her. She, for years after getting the technique, was still, working her way up to, in my language, I guess, thawing the iceberg. And so you're saying, Courtney, for the record, that there's no evidence that teaching young kids fluency techniques increases the likelihood that they're going to, quote, outgrow stuttering.
When you say no evidence, it's a controversial statement. I would say that there's inconclusive evidence to suggest that it would, but there's definitely conclusive evidence to suggest that if you are not targeting their communication attitude, if you're not targeting their communication competence, if you're not targeting advocacy, then you're setting them up for the development of an iceberg that could be significant. And Annie, can I mention Annie Glenn? I did get to meet her. It was probably one of the most special days of my life. She came to ASHA, and so I stood in line to meet her. And I would just echo what he said. Her words to me was, it's not about the fluency, it's about the communication, and you keep doing what you're doing. And so I think, it's like, I know that, I know that the people that know are the people who stutter, but the people that we listen to are the people who don't. And they're trying to, change it. And I just say, why don't we listen to the people who've actually experienced it? Why are we listening to people who, talk a lot, but don't do a lot of clinical work? I don't know. I mean,
that, and who don't see the client when they're out in the real world, they don't,
right.
And they don't really, they just don't understand the fact that the techniques, fully fall apart when you leave that comfort zone. And it's sort of like the talking with the dog effect, right? Or talking by yourself. Most folks who stutter don't have much of a problem when they're alone or when they're talking to the dog. That's not universally true, but it's largely true. So, it's the real world situations where communication happens, right? Mm-hmm. We all have a life, and that's where we talk within our life. And it's just, so to summarize what you're saying, and make sure I understand it right, there is clear evidence, which I've experienced, many of us have experienced. So I fully believe this, and it doesn't surprise me if there's clear evidence that essentially ignoring the below the iceberg stuff when they're 3, 4, 5, 6, and not just saying, oh, it's okay to stutter, little Johnny, but here, let's teach you this. And if you're using this, then you won't stutter. So don't worry about it. But rather focusing on that acceptance, that basically coming to the conclusion at a young age, it is what it is, like I have a stutter, but it's not going to stop me from living my best life. It doesn't have to stop me from that. And then you don't miss your whole childhood. I mean, those probably would have been a really fun I know a lot of people, non-stuttering people included, sometimes have some tough experiences when they're growing up during high school and all that. But I know, because as soon as I got to college and I found my confidence and said, screw it, I'm going to say what I want, I immediately looked back on high school like, man, I almost wish I could do that over with this newfound perspective.
Yeah.
And I would have certainly made a lot more, tight friends from high school than I made. I still have my two good friends and a couple more that I knew a little bit and then got to know after when I was in college. But so there's clear evidence that a lot of speech therapists have done a lot of harm, and not intentionally. They weren't trying to hurt anybody. They were trying to do their best, but that they've done a lot of harm to kids who stutter that totally contributed to them forming that iceberg. I describe the iceberg in 3 words. It's a sense of inferiority. That so long as I'm stuttering, I am inferior to the other people. And let me read a quick quote from a guy who's in his late 20s. You were talking about, this is universal, going around the world. He lives in India,
Mm-hmm.
which I've heard from several of my Indian friends that stutter. You get more overt comments in India about your stutter than they've experienced in the United States, for example. Like a friend was in line trying to buy a train ticket once. They're in India and there were a bunch of people behind him, and he couldn't say which stop he wanted to get off at when he was buying the train ticket. And so the person selling the ticket was like, come on, man, you had all this time in the line. You didn't think of where you wanted to go. And then people behind him were like, hurry up, we got to go. Like everybody just sort of started yelling at him, And, so it's I will grant and I've heard this from friends that are from China too, that perhaps it's a tougher environment. There's probably a little bit tougher environment for folks who stutter from the standpoint of not having a culture which is as focused on tolerance, for example. That being said, this 28-year-old, I believe he is, person that I'm working with in India. So we did a couple sessions of the eye contact training, coupled with us talking about the fact that, like, hey, we're learning here that the world continues to spin, even if we stutter a lot.
Mm-hmm.
Sun comes up tomorrow. It's really not the end of civilization. This was his quote in the group. We have a WhatsApp group of the new trainees. He said, I never thought that people would hang in there during my stuttering block, but they did. And even after seeing my physical struggling, they treated me as an equal person. They talked with me like I was one of them. So that tells me, and I think that says a lot into the mind of many of us folks who stutter. He's been walking around the first 28 years of his life, or at least, since he developed the iceberg, thinking that he's almost a different species from the non-stuttering people. There's such a sense of inferiority. And, this is in New Delhi where he was doing this contact session. We do it over Zoom. Everybody's on their phone. One person talks to somebody where they are, and the other person talks to somebody where they are. 1 or 2 sessions of this in New Delhi, which if you ask Indian folks, they'll tell you, I don't have an opinion on it, but they'll tell you that New Delhi's kind of like the New York City of America. Mm-hmm. It's known by the people in India to have and I'm not calling anybody rude, but it's known to have the rudest people in India, New Delhi. Anyway, it's the biggest city. So it's not a cakewalk doing contacts, or you wouldn't think it'd be a cakewalk doing contacts in New Delhi, India. But he did them, and he was shocked by how people, even when you're doing that, if you're hanging in there, finishing your sentence, that people were just answering his questions, almost as if like he wasn't stuttering, right? And that's happened for person after person. It's there for the taking, as far as realizing that stuttering is okay. But again, with coaching folks, with working with folks, it's trying to undo the deep and dark iceberg that's been formed for decades for them. So if you can prevent it in the first place, that is going to be a game changer in the history of stuttering. Maybe not the quantity of overt stuttering, although I would suspect that people that are more self-accepted and are not afraid of stuttering probably are going to struggle less with their speech. That's at least very logical. I don't know if the evidence shows that yet, but regardless of how much they're stuttering, their quality of life, which for a 5-year-old or 8-year-old, whatever, that you're changing that for them, well, that may be 90 years. That may be 95 years of quality of life in front of them that's going to be much better. That is immensely valuable for somebody, as opposed to doing the opposite, deepening their iceberg or helping to create the iceberg in the first place. So I hope,
We're waiting for it to develop and then saying, now you're ready for therapy. Now I'm ready to tell you what stuttering is. And you said the young person you mentioned, he said, now that I feel like I'm one of them. Let me tell you what anyone who is at risk for discrimination, who is at risk for feeling inferior, marginalized, what is the number one reason for that? It is conformity. It is, you have to be like, look like, talk like, walk like in order to be okay. And what are we doing when our primary treatment is to try to force that conformity? And that's the whole point. It's like, if you can understand that communication isn't defined by fluency, and there are all these other core competencies, eye contact being one, but multiple others too, gesturing, body positioning, movements within your space, your opening, your closing, your organization, the language you use, all of that. That's so much rich, area of focus for treatment and advocacy. And people will say, well, children can't understand. Well, just last week in our intensive, we had a 6-year-old. Think about this 6-year-old child. He has had already 3 different types of treatment. All the treatment has focused on, the common factor has been to try to get him to not stutter. This was the first time he ever learned what stuttering was. First time he and his mom ever talked about stuttering with each other. He learned what it means to share about his stuttering. He learned he could watch and say, oh, that was not good the way that they shared, because they didn't make eye contact. They weren't really smiling when they were saying it. They looked like they were uncomfortable. That one was good because they were looking directly at the person. They were kind of smiling slightly. They actually used their hands to gesture. He was able to practice that. He was able to learn things about stuttering that he never knew. Was asking so many questions. And I mean, what his mom reports is that his life changed within just a matter of days. And it's like, most of the children that we work with are unusually bright. They get what's going on. And it's the adults that are so afraid to have the conversation. But just having the conversation could be the key that prevents them from, living their life in a way that is really painful. And that can really, as you say, reduce their overall quality of life and not only impact them, but their entire family. Because no parent wants to see their child suffer. And here's the other part. Parents are okay with stuttering too, as long as they see that their child is okay. I mean, and so, you have to help them to be able to see also as a parent that communication isn't defined by fluency, that their child is going to be okay. And there are certain tools that they are going to need to be able to navigate adversity. But, once they've got that, then they're good. And they need to be able to do it on their own because their parent can't be there with them everywhere they go. It just isn't possible. And parents are like that commercial where you see the child driving the car and then they're grown up. I mean, you're always thinking about, what about when he's 40? It's like, well, if we can focus on getting him okay with it now at age 4, we're not going to have to worry about age 40. But if we spend 15 years of his life trying to get him to speak in a way that's not natural to how he naturally talks, which a young man, 13-year-old, said, when speech language pathologists have tried to get me to talk without stuttering, they were essentially trying to get me to not talk. Because when I talk, I stutter. And I just wish people could understand that.
I hear you. And that's, Yeah, and I have no doubt in my mind. I mean, no one can predict the future, but it makes total sense to me. I mean, this all makes total sense, and it would shock me if this isn't the future of how to work with young kids who stutter. And so the question then becomes, right, how do we accelerate it? And I know, that the trying to get all the school districts to do that is certainly a start. And I don't know, like I said, I'm a dentist. I know in the American Dental Association, the ADA, there's a certain amount of politics. I would assume that ASHA is the same way.
Yeah.
Would it help a lot if ASHA would come to this conclusion as well?
Yeah, we're working on that, and I'm working on that actually at a national legislative perspective. So we have a mission, and part of our mission is to change, it's to change third-party reimbursement. It's to change the education of speech language pathologists at the graduate and the undergraduate level. I do think it all needs to happen together, though. It's not enough to say, okay, we're going to get coverage for therapy when the therapy itself isn't quality care. And so it's got to happen at multiple stages. We have to train more students. We can't allow for people to continue to graduate without having the same type of standard training that we get for language and articulation and phonology, which is all core to our scope of practice. But arguably stuttering is the most core. I mean, it's one of our founding areas. We own it more than anything else, and yet we are not doing our best, and we could certainly do better. And so, yes, we are involved with ASHA. We're also involved, with the president's office. Obviously, he is a person who stutters, and so it's an important time for that. And I do also want to speak with him because he often talks about overcoming stuttering, and I'd like for him to think more about what that means and what that indicates to younger people and adults as well, because stuttering is on a continuum. Everybody stutters to different frequencies. Overcoming, when we define what that means, it means simply being able to say what you want to say when you want to say it. That's what it means. It doesn't mean not stuttering. And so that's critical, but I think we have an opportunity to get some legislative changes. The district change really matters because they're on the ground, they're working, and it's easier to get, into the private sector to get people to be on board. People who are working within the school setting, they have to follow their guidelines. And so, but they're very receptive to change. And I think, the one other argument that I would make is that we are training students at a very high rate. We probably train close to 200 students a year. And the reason for that is that they're the future. People will often argue like, well, I will train a handful of students, but I only want the best of the best. Or I'm not going to train students because the quality of my therapy is going to not be as strong. But the reality is you're only one person. And if you're not training, then you're not going to be able to impact as many. And even our youngest undergraduates, they can do exceptional job working with people who stutter. They just need to have the education and the foundation and the support. And it takes extra time, but it's a pay me now and you're going to get a lot in return later. And so I also see that the earlier they're exposed to stuttering, the more likely they're going to want to specialize. So, our mission is to essentially scale programming so that there's access to quality care worldwide, to foster a global pipeline of research and clinical faculty who specialize in the area of stuttering, and to increase global knowledge of what it means to stutter and what is truly best practice.
Good stuff. And for people, for parents, for example, of kids who stutter, do they have to come to Austin where you are to participate with your program, or is there a Zoom option?
There's Zoom options, but we also we offer our Camp Dream Speak Live, which is an intensive holistic program for kids who stutter annually in various locations around the world. Austin is one, Ireland, Belgium, Mexico, Portugal, Malta, Atlanta, Georgia. We also are going to offer it in Nashville, in Philadelphia, Los Angeles. We've got several other places that are on the horizon. I'm not sure if I said all of them, but and we have a satellite center that just opened in Atlanta, Georgia. We have a burgeoning satellite center in Philadelphia, another one that's set to begin in Nashville, and we're continuing to just move forward. And we've got a lot of people working hard to try to help enact this change and to try to touch as many people as we can. We don't charge for our services either, just like yourself. We just, and the reason why, quite frankly, is most everybody that I've worked with has come to me and they've already spent tens of thousands of dollars on therapy that didn't work. And everything that they're sharing is helping us to move forward and to evolve in our approach to really be the best that it can be. And so it's a way of us giving back. It's just a mutual exchange there. So certainly we're gaining a lot, and hopefully they are too. And so there's opportunities. We have groups worldwide, just like yourself. And so I think we're in a new frontier, and we're training students from all over the world too, because it's important that they can go on. We're training professionals all over the world, and we're doing our best to just create an opportunity for people who stutter to live their lives to the fullest.
That's fantastic. And are you doing that through the Arthur Blank Foundation, who funds your center in Austin?
Yeah, so it's actually, I'm glad you said that, because with every step forward I've made, I really am indebted to people who stutter again. So when I first started at UT, I was literally in a custodial closet. I was working on my NIH postdoctoral fellowship, and it was essentially focused on the etiology of stuttering. And they literally took out like the mop bucket and stuff and put a desk in there. And I was so happy to have a door that I could close. And as I was completing the studies associated with that, I had people who stutter who came to me and asked me for therapy. It began over time, where steadily I was seeing so many people that I needed to hire someone to help me to actually provide the services, because there wasn't enough time in the day. And Manny Bodner, who is himself a person who stutters, heard about our work, and he endowed my research lab, which has been renamed the Dr. Jennifer and Emmanuel Bodner Developmental Stuttering Lab. And then a few years after that, it was important because I got a little bit more savvy in terms of how the university system works when you get endowments, and how can I make sure it actually goes back to the stuttering community. And I met Mike Lang, who is also a person who stutters. And he was very, keen on supporting us and wanting us to be able to grow. And he was also very smart. And I was able to talk with him about how before I couldn't really use the funds to really make sure we were able to provide more services. So we set it up. So essentially it all goes back to us being able to reach more people. There's, nothing in it for me personally. It's all just towards us reaching more people. And so then that established the Michael and Tammy Lang Stuttering Institute. The third branch is the Dealey Family Foundation Stuttering Clinic. And so Joe Dealey himself does not stutter, but he visited our program and saw everything that we were doing and just thought, he could see that lives were being changed. It's really hard to describe it until you see it, and he wanted to be able to support us. And then I applied for the legacy grant through the Blank Foundation, and it essentially creates an infrastructure for the three arms: the research, the training, and the treatment. And those funds, for the last 20 years, I've essentially had people volunteering, to help me, students, kind of an army of students, but I've actually been able to hire some really talented people to help me to run the satellite centers, to carry out the programming across the world, and to scholarship students. I'm a real big proponent of training and getting opportunities for students, especially underrepresented students who wouldn't otherwise normally have the opportunity, so that they can get out and they can make a difference in the world too. And so that's what that funding supports. And we're going to keep going. I mean, we've got some pretty significant, large, time-intensive goals, but it's what drives me every day. And again, as I said at the outset, everything I've learned from people who stutter. Every step forward we've made, we've been able to make because of people who stutter. So I'm truly forever indebted.
That's awesome. I feel like you're on the front lines of a revolution there, and it's like we said, there there's always going to be folks who stutter, right? And so, and there's new ones. I mean, I think about that sometimes, that there's 11-year-olds out there right now going through the same thing I was going through, and all other ages. But that's awesome that you've found those paths, to get things funded, and, building up this overall effort. And I think I think that's a lot of they say one of the big keys to happiness in life is having purpose.
Yeah.
And it sounds like this journey has given you a lot of purpose, and I can tell you're super passionate about it, which is actually, in my experience, and this is not always true, but folks who stutter oftentimes are the most passionate people about stuttering. But it's awesome to meet somebody that doesn't stutter, that's equally on fire for the cause. So
Thank you.
But
Well, I'm the only other personal thing I would say. It's like I have 3 boys myself, and I just try not to cry, but it's like they've spent their life around people who stutter, and it's like, I can remember my oldest son. Actually, his name is Michael. We were at an event, and I heard the microphone feedback. He was 5 at the time. He's now 14. But he was like, "Hi, my name's Michael. I started stuttering when I was like 3, I think, and I had to like stop in my tracks. I mean, I was like, I don't understand, why is he saying this, because he doesn't stutter, right?" And so I had to, stop him, and then kind of use it as a teaching point to say, not everybody stutters. But in that moment, it's like, really, he sees it so differently. I mean, that's like, they're unique beings. As adults, we get to a place where we're jaded. We've lived years. It's hard for us but kids, we can capture them at this point in time where, they really don't see a difference as a negative. And so if we can try to capitalize on that, to really take that magic and make it impact the rest of their life, the world really could change. So my quest is that we stop waiting. My quest is that we start today. My quest is that we recognize that we have an ethical responsibility to not do harm. And that doesn't mean ignoring it. That doesn't mean, waiting and seeing. That means educating. That means advocating. And that means teaching, and not teaching in a contradictory way, because kids are very smart. And so you can't tell them one thing and then actually have them practice something totally different and expect them to believe you. They're going to believe what you ask them to do. And so we have to really take that into account.
Yeah, amen on all that. And again, I thank you for everything you're doing, Courtney, and
Thank
for
you.
joining us here today on the podcast. I know that this is going to be very good information for a lot of people, and hopefully a lot of people watch it, and hear your message, and I've thoroughly enjoyed the chat.
Well, thank you. And thank you for everything you're doing. Truly, it's an honor to be here. And I just thank you for all that you're doing to push forward what's best. So I appreciate it.
So take care, Courtney.
Okay.